A warm welcome to one and all gathered here. One small smile is enough to make everyone's day better. Dentists are smile designers. You guys are here. The future dental specialists will be the reason for many people smile. Now we get into the session. The Chennai International Youth Fest is one of the world's biggest youth conclaves of India, organized by the National Youth Council of India with the support of Government of India and Government of Tamil Nadu, United Nations entities and several other institutional bodies. CIYF pioneered in 2017 to create a platform for youngsters from various streams to showcase and build their interests and talents. CIYF 3.0 was a grand festival that witnessed about 1.5 lakh young spectacular talents across the globe participating in over 170 events and activities in 90 plus venues. More than 5,000 medals were given to the winners and runner ups. We are proud to announce that the fourth edition of CIYF is back with a bang. On this wonderful Sunday evening, despite the pandemic situation, we are glad to see you guys here to spend your time wisely with a very knowledgeable person, Mr. Aravind Babu. We welcome you, sir. Dr. N. Arvind Babu, MDS, FICD, Fellow International College of Dentistry, USA. He is a professor in the Department of Oral and Maxillofacial Pathology, Sri Balaji Dental College and Hospital, Chennai. He is an assistant director at the Center for Oral Cancer Prevention Awareness and Research, Bharat University. He is a consultant oral oncologist at Apollo Proton Cancer Center and Rela Hospital, Chennai, an executive member in Indian Association of Oral and Maxillofacial Pathologists. He is also an associate editor in the Indian Journal of Multidisciplinary Dentistry. He has authored 39 books, published more than 172 research papers. He was the first of its kind in the world to come out with dental awareness book in braille and sign language CD for hearing impaired aspirants. He, the director of Irwin Multi-Specialty Dental Care Center, Adambakam, Chennai, is here for us today. We welcome you, sir, with a great joy. Now, I would like to hand over this session to you, sir.
Thanks a lot, madam. Thanks for your introduction. A warm good evening to all, and I'm happy for the organizing committee for giving me this opportunity to interact with you. Usually, I have seen a lots and lots of scientific stages where I used to deliberate my scientific lectures, my case presentation regarding research, regarding publications, regarding textbook writing, all those things. So I feel very happy. This is the first time I get an opportunity to interact with the population of youth and budding dentists. I hope all participants or belongs to dental fraternity or medical fraternity, whatever it may be. It's my great opportunity to interact with you, and my heartiest wishes for the team. They're doing successfully fourth year these kind of programs, which our government of India and the state government supports a lot. I've seen the program agendas and program schedules. It's very impressive and interesting. So today I just want to interact with you regarding something about dentistry. I heard from the organizing committee that this is a workshop regarding dentistry. So I thought most probably all the dental surgeons and those who are pursuing dental academics as a person or those who are practicing, they have their own knowledge about dentistry. Here, I'm not going to say anything or I'm not going to teach anything as a subject perspective. I take this opportunity to have an interactive session with you. So I'll start my own career and my own path, how I came and how I achieved all these stones. And this should be a sort of mild initiative for some others, my fellow dentists and my fellow students, to take the faults what I have done or takes the route what I have taken to implement in their own life and own progress of their career. So I didn't came here with a sort of any PowerPoint presentation. I'm not going to talk anything regarding dentistry. I'm just going to convey a message to all dentists or all the audience. What exactly? Basically, this youth program, their development program, they're giving each and every, they're giving a brief knowledge about each and every categories, like a sort of what you can do in engineering, what you can do in biomedicine, what you can do in medicine, what you can do in dentistry, like that. So here we have got association with Ayush, so we can learn about alternative medicine. You can learn about all other aspects, everything. So now I pursued my undergraduate from Bangalore. So probably my career story will be a sort of 2 minutes or 3 minutes. I will just take. I came from a middle class family. I took dentistry as a option, not as a prime wish for me. So here I just want to say my co-participants or those who are attending the meeting that what you call passion. Passion is nothing that what you are training. You just implementing what you are doing perfectly. It's also a passion. I never dreamt. I didn't had a dream about becoming. I will become a dentist, or I will become an oncologist. I will become a book writer, or I will become a publisher. I will become a consultant oncologist, or whatever it may be. My career started as a normal dental surgeon, various student. Because of the circumstance of family, I adopted this course. I pursued my undergraduate at Bangalore. I pursued my postgraduate in Chennai, Sri Balaji College Hospital. So these times, I had lots and lots of hurdles to come across. So those periods, we are like blank. We don't have anybody to guide us what to do. We don't have to anybody to guide us what to study, what is good, and what can be what we can where we can modify our career pathway. So this we got a very good platform. These organizing teams are arranging from different pioneers from different field, saying you that you have got a different opportunities, all these things. So basically, we as a student, I want to convey a thing that we study for exams. Of course, I also do study for exam point of view. At one stage, when I became a teacher, then I realized that studying is not for passing. Studying is for understanding and implicating. So where you apply your knowledge, where your knowledge is getting used, that is success of your study. Not the medal what you've got, or not the score what you have got, or not the rank what you have got. You may be whatever, don't get inferior, that you're not getting marks, or don't get superior feeling that you're getting the highest ranks, all these things, that thing and that. Where your knowledge is utilized 100% to the society, where your thoughts and where your ideas are unique, and that is going to give the betterment for the society, those ideas, those thoughts, and those application of knowledges, that is your success of your degree, your success of what you have learned, what you have learned. So this point I just want to convey to everybody, whatever field, wherever you are, you can take this point from me. That's whatever you study, whatever rank you get, only then you apply your knowledge to the society. Apply your knowledge with the society, how much gets benefited from you. That's the purpose of your study. Let me come to my field, or our field of dentistry. Basically, previously, some 35 years back and all, we don't have a separate branch of dentistry. It was taught under Bachelor of Medicine, Bachelor of Science, MBBS. Third year curriculum, they have a 3 months or 6 months course about dentistry. Then after that, they thought that dentistry is a vast subject, so we need a separate fraternities. We need a separate course for that. So they have formed the Dental Council of India. Apart from Medical Council of India, they have started a course called Bachelor of Dental Surgery. They have framed a curriculum for dental surgery. So I feel those who are studying dentistry, they are nowhere inferior to other medical fraternities. So people think that I got BDS. My colleague, my friend got MBBS. So I am inferior and she is superior, or he is superior and I am inferior. So they are doing a bachelor degree and you are doing a bachelor degree along with master specialty. So when you are coming out itself, you are coming out with a specialized branch. You are specialized in a particular branch, like how an ophthalmologist. You can't expect an ophthalmologist to come out from undergraduate. You can't expect an ENT surgeon come out from his or her undergraduate. You can't expect a nephrologist, but you are coming as a dental surgeon immediately after your undergraduate. So once if you want to pursue your dental surgery, it is not easy. You can study only about your teeth or associated structures. You have to basically know each and everything about anatomy, physiology, biochemistry, and everything in body, because that's basic things. Until otherwise we know our complete total anatomy, physiology, and biochemistry of our body, it all our organs and tissues functions at the same way. Our like a general medicine people study. So we are studying both the basics of medical fraternity and also specialist thing of dental dentistry. So till there's a sort of slight stigma, what I feel that no, I again for MBBS, I didn't got MBBS, I got BDS. And so what I personally feel, you have an option with you, which is a very successful option with you. You can do a miracle with the option of choosing dentistry, and you can do many things with the given taken field. Better what I feel is, if you compare yourself to others, that's a big insult you are giving to yourself. Don't compare yourself with others. That's a major mistakes what we do in academics, in life, or whatever it may be. We start comparing ourselves to others. We start comparing our education with other education. Say every education, so every education system, so every degree has its positive and negative points. So we have choose dentistry, and we should find positivity in that. And I my point of view as a teacher or teaching faculty, I've got an somewhere around 18 years experience for teaching both undergraduates and postgraduate student. So I have got a major analysis of students' mentality 15 years back, how they are, 5 years back, how they are, and current situation, how they are, what we need to address to them, and what they exactly want to deliver to the society, or what they exactly want to deliver to the society. These things I have analyzed in my 18 years period of teaching. I just request the audience, those who are pursuing dental surgery, you just probably the understanding of the subjects may be a bit difficult. The thing is, basically you try to understand the concept and the study. That you are belongs to a professional course. Medicine, dentistry, all belongs to a professional course. You are going to serve the society, because your knowledge is going to be worthless knowledge. Not even amount of course billions and billions of amount can equal to an saving a life or something. People kept you people, or myself and the medical fraternity, close to gods or near to gods, or they think they assume us as a really God only. When we save the life, or when my specialty, I deal with head and oncology. If I find a cancer at the early stage and I cure a cancer patient, if I say a cancer patient, I'm in a life saving position. So I never felt that I'm a dentist, I'm inferior, I'm not I'm just doing only extraction, and I'm doing only filling, or I'm doing only other jobs with like that. So it's your passion. You have to groom yourself in such a way that where you have to land, what is your path, how you have to travel, and where you're going to land. Then at current situations, there are so many concepts of discussions going on, whether dentistry we can able to survive in dentistry or not, whether dentistry too much of dentist populations there everywhere, engineering too much of populations are there, medicine too much of outcomers are there, dentist every branch they have own outcomers. It's up to you, up to personal determination that I can survive in any situation. It's this is not a what I say. You can't expect a campus interview at a dental college, or you can't expect a campus interview in a medical college, and they will take you and they will give you a job. It's up to you to prove yourself among the society, the quality of treatment, or the quality of handling your the quality of skills what you apply. that is going to be the investment of your career, and you can achieve in whatever way you want. So you are going to determine, or you are going to frame your career. Nobody is going to be your boss. You are going to be your boss, and you are going to achieve what you want to do. So initially, for I think another 10 15 minutes, I just talk whatever I want to talk. And in the meanwhile, I request all the participants to come up with some questions. Somebody can moderate, and it will be easy for me to interact more like that. So you just come inside and study. So you have a different setup of undergraduate curriculum in different parts of the country, but only one syllabus. It comes from Dental Course of India. That's one thing. So second thing is, during your undergraduate period, during your course, whatever you learn or whatever you practice through patients, you can't get the chance again in your life, because only in dental colleges and only in dental schools they will teach you both theoretically and practically, and allow you to pursue your knowledge and skill over patients. So that's a very great thing. So so many patients, they are volunteering themselves coming to the college, and they are none of them, they know that you are going to extract the tooth. That's your first extraction. So you won't allow that to others. If you are in that position, will you go to you be as myself or my parents or my son? I'll take to an experienced doctor. I won't take to an practicing. I would to go take my son to a learning dentist. But those people have a trust on you and coming to you and showing their mouth to treat whatever treatment, dental treatment you are doing. So it is your responsibility that I have to do my job sincerely and perfectly to them. This is a very big public service, and you have a very great social responsibility. And your social responsibility is much more noblest than normal practicing dentists. Normal practicing dentists, they charge, they have time, they have investigative modalities, they have everything, they have affordable patients, they can do whatever they want. You in colleges, you get both affordable patients and unaffordable patients, and they blindly trust you and coming and opening their mouth and showing to you for any dental treatments. So I personally request you to see each and every patient as a part of your family member. You're treating your father, or you're treating your mother or brother or sister or a friend, whatever it may be. Those kind of concept, if you come know, two things you can gain. One, you can give quality of treatment. Other thing, you can train very well to equip to treat your parents. You can train very well to equip yourself to to give the quality of treatment to the seekers. So they came from poor socioeconomic status population. They only comes to dental institution educations. That's the thing. Now, second thing what I want to convey is, um, basically the dentists should think, dentists are under the impression that there is a there are a group of people, they are called as practicing dentists, those who practice in their own clinic. There are a group of dentists, those who are doing research, they call it as researchers. So what I feel personally means, we don't separate practice and research. We doesn't need anything extra fitting to become a researcher. Basically, each and everyone are a researcher inside, but we don't explore the researcher inside us, and we just go and practice. So everybody can take the cup of research in their hand. It's not a very difficult job. It need not be you have to dedicatedly sit inside a lab in a closed door, or 18 hours, 24 hours with all the hi-fi equipments, all these things, then only you'll be called as researchers. So something you find which is useful for the society, or something which you find which is going to eliminate the disease, that is a research. Not no, don't think that I have to find a gene, or find an RNA, find a particular point for the disease, then only called as researchers. Still till now, I have a what I say, I have a feel that in dentistry, in only in dental field, there are so many advancement came, so many researches are happening. We have crossed so many achievements of western countries and other countries. But still, my personal feel says that dental caries is the common microbial disease in my country. I won't say tuberculosis. I won't say leprosy. I won't say polio. I won't say chickenpox. I won't say COVID. I won't say corona also. Comparing to these calculations, what you see 10 lakhs, 20 lakhs, 30 lakhs, 40 lakhs, and all, the people affected with dental caries, you can't even compare with them. This is the commonest. And I feel so many kids at the age of 3, 4, 5, after the eruption age of 2 year, 40, 2 years and 7 months or 8 months, no, they are suffering from intensive dental problem. So the dental problem itself will make a very big psychological trauma for the kid, where parents won't understand itself. So starting from eating, starting from feeding, so the total health will get spoiled of the health. So you are going to address the population in such a group, the growing age itself, to make the life healthier, to make them smile wholeheartedly, to make their life very, what do you say, healthy lifestyle. So when your mind thinks about all these things, where we were lagging, when you find three lacunae, you try to fill that lagging lacunae. You're the researchers. So you have the knowledge of development of tooth at the sixth week of intrauterine life. So, for example, I don't know, those who are dentists, you can easily understand my point. Sixth week of intrauterine life means uh, after the pregnancy is confirmed, 2 to 3 weeks or 4 weeks. So in that stage itself, tooth development will take place. So these things are not conveyed to the public. So the problems can be addressed either by bringing the awareness to the society, or bringing the awareness to the parents, or doing some research or some things. So we believe about research. We just think where we are lagging, where we have to give our awareness. So here in our current situation. Hope you are all following. By chance, anything if you don't find, you just text in chat box, or somebody can we can discuss later. So here, usually at the fourth week, menstrual cycle will get over. So the Indian ladies, they will see for fifth, sixth, or seventh week. Then seventh week only they realize that I'm not getting a normal cycle properly, and they will go to a gynecologist or general physician to check. That time when they see whether they are pregnant or not, will confirm the pregnancy, in that time only your intrauterine development of your fetus will start. So the initial period of third week, fourth week, fifth week, the care is totally lost. The health system is totally lost by not carrying the embryo, or not carrying the fetus at the very initial stage itself. So we have a total number of populations where the cycle comes once in 2 months. It's also normal only. So they don't. So many of them, they don't know that they are carrying a baby, or they're carrying the thing. So here, as a dentist, I want at the sixth week of intrauterine life, or inside the fetus, my teeth and my bone are going to develop. That time, whatever calcium or whatever minerals or whatever nutritious diets I take, that is going to help my kid. So here, in that peak time, the mother and father, parent, they just neglected about pregnancy only. So we are in such a situation. So this is not a big research what I'm going to do. What I am requesting you to do. This request what I'm keeping, you just make an awareness to parents. See, now you just think. Now there is no inferior feeling. Now I'll just say personally how superior I am. Now what I am doing? No, I am talking in a gynecologist conference. I am just talking to gynecologists. There are nowadays there are so many infertility clinics. They are planning the pregnancy, so they are very well know when they're going to pregnant. So I am just uh, discussing with the gynecologist and saying that what exactly or when exactly you have to start your folic acid and calcium or iron supplements, and what way it is going to help teeth, oral and paraoral structures. That's the important thing. And one more thing, when you plan for baby itself, then you have to convey your infertility centers to get a dental opinion. So once if you get a dental opinion, at least we can remove the parents or mother's dental ailment like decay tooth can be addressed, wisdom tooth can be addressed, or filling can be done. By so many things are not monitored. So exactly at the third month of pregnancy, they will get teeth pain. They will get some sort of other issues. So they are forced to take some antibiotic painkiller. Then they will be scared that whether I can take antibiotic or not during pregnancy, or whether I can take give medicines or not during pregnancy. So at one hand, we are topmost in the globe having the higher end of research equipments and higher end of treatment modalities. In other hand, the parents are not educated, the kids are not educated, the patients are not educated. So nowadays, I think wearing mask and keeping social distances, it's like a sort of thorough thing among the public across the world. But brushing twice a daily, I don't know how many of people will be thorough in that. That has not reached that much. We have not reached to the core of the people about dental hygiene, about dental health issues, and about what is happening in dentistry, or how can we prevent. Prevention is better than cure. We can't. So this is a. Most of the participants, those who are dentists, they know that dental caries is an irreversible microbial disease. That meaning that none of the drug what I give, it won't reverse the disease and the normal it will become a normal tooth. It's irreversible microbial disease. I can't treat. I can't treat. I have only weapon in my hand is prevention. I have only weapon in my hand is to create awareness over the public. I have only weapon in my hand is create awareness among the co-medical professions. So in that way, as a dentist, those who are pursuing dentistry or those who have finished dentistry, you concentrate. You have a lot of job opportunity. For example, in my last few sentences, you can apply for a job in an infertility center as a screening dental surgeon. So you can screen and you can do your job, and you got a job as a dental surgeon. You can screen and you can write a report that these are the things has to be addressed before IVF treatment. These are the things to be addressed before the artificial insemination or whatever treatment they are going to give. So we have jobs. It's nothing like open a clinic and sitting for patients. You have to reach the patients, and you can sit along with the gynecologist. And then one more thing, medical professions they have only 2 to 3 months knowledge about dentistry. The 2 to 3 months knowledge about dentistry also they are not trying to find a fault. That is not sufficient for them to understand dentistry. So we are studying a 5 years course, but how can we expect our co-medical fraternity people to understand the complete dentistry and the process of development of tooth and maintain hygiene and what and all the anomalies of tooth in 3 months? That's not possible. So if I chat with some of my medical friends, I leave about general populations. Even my medical friends, those who have in other branches of medicine, they themselves they don't know when the teeth will erupt and when the teeth will fall down. So now it is in my hand to educate them when the teeth will erupt and when the teeth will shed. So this is very important because recently, among 10 to 15 years, and recently in Mofussil and cities only, patients are searching for a dentist. Okay, not searching for specialist dentist. They're searching for a dentist. Otherwise, for any pain or any wound in the mouth, they go to general physicians. They give some medicines. Okay, till the myth is going on that if any decay is there, that's because of calcium deficiency. If any decay is there, it's because of this problem only. So that decayed teeth is not addressed properly as efficiently it can addressed by a dental surgeon. So in that period, because of lack of knowledge of eruption and shedding ages, the general physician they say that this is tooth. No, it's going to fall only. You don't have to bother about this. They don't know which tooth will fall on sixth year or which tooth will fall on 12th or 13th year. So that is another lacuna. So now I say that you just concentrate on pediatric patient, sit with the pediatrician, and you can get a job opportunity. How am I going to see the patient? So now you just think, are we inferior compared to other field? So we are not opened up. we are not showed our complete potential to the world or complete potential to the medical fraternity that we are a specialist. So we are still inside the shell that, like what I say, that we ourselves feel inferior among us. So just break out all these things. Say I'm not inferior to anybody. I'm not superior to anybody. I am myself, and I do perfect job what I learn and what I'm going to do. That's an important feedback what I want to take over message to them. So like that, no, each and every stage there is there's a lots and lots of awareness should be carried out. Probably since it is the program is sponsored mainly by government of central government of India, state government of India. It's right we can speak in this platform. We can put your feedbacks in this platform so that it can be easily addressed. And some state governments are addressing the dental issues carefully. Some governments are addressing the oral soft tissue lesions very in a good manner. It is our duty to present ourselves to the public, to the doctors, to the government that we are capable of doing like that. So, for example, I'm a oral and maxillofacial oncologist or pathologist. I deal maximum with cancer patients. So, with my experience, I can see the change of tissue at the initial stage of cancer, which is a normal tongue or which is a tongue affected with an ulcer. Whether the ulcer is a normal ulcer because of stress-induced ulcer or because of trauma or because of cancer. So I am in a position to diagnose this ulcer. So now I am an authoritative person with my normal eyes without any investment. I am diagnosing a cancer at the early stage. So if I present myself to the government, they can incorporate people like me or people like dental surgeons, and they can incorporate and give a job in each and every primary health centers or each and every district headquarters health centers, and you can examine the patient's oral cavity as a complete examination, hard tissue and soft tissue examinations, so that you can save lots and lots of oral cancer prevalence. Now, oral cancer stands at the topmost position. Number one position, which cancer is common in India, means oral cancer, we say. We do have a habit history, we do have other histories, whatever it may be, but we have a special knowledge about the cancer and potentially malignant disorders, precancerous lesions and that. If not me, who will do that? If not you, who will do that? So this point I just want to incorporate yourself. See, you are equipped to diagnose a lesion with your normal eye or normal vision or normal inspectory findings. Then you can go for lab investigations or some sort of scans or whatever it may be. So these things that and all, we have to project ourselves and we have to convey to the government. We have to prove ourselves that we are capable of doing those things, and we are specialized in that. We deal with maxillofacial and oral maxillofacial region very in-depth knowledge. We treat with patients with in-depth knowledge. So I am capable. So here the job opportunity is more. We are not addressed to the government or the state government properly. Like we never showed us what a dentist belongs to. So I feel dentist is one among the lifesavers. Nobody knows that teeth decay is fatal. A teeth decay, if left untreated, it becomes septicemia inside the body and it may be fatal also. Nothing like that. A cardiac arrest or some other problem only will be fatal to life, not a teeth decay. Just let the teeth go, all this and that thing. The purpose of dental education is you study, you're doing, you're practicing. Apart from that, my points or my views will be you just expose your talents to the outside, or you just expose your individuality, you just expose your knowledge and your skills, and you serve the society. Automatically, this will be a message which will be carried out to the other sets of population. You get more amount of patients. That's the one thing, and you have to find your place on your own. Nobody will come and give you a hand. No, come, you have a job over here in this district, or you have a job over there in this headquarters office, or this cancer institute, or this cancer hospital, or this thing, that thing, and that. So there are so many corporate setups, corporate centers. So you as a student, you try to acquire all your theoretical knowledge, whatever you see in textbooks, and do your hands-on training of whatever things you are learning in different departments. Basically, I'm not sure that what are overall my group of audience, but I just say this is a common statement for all medical practitioners or people from youth wing or people from students from or practicing dentists. So there is a big lacuna in reaching of dental hygiene to people. So we are very particular about other diseases, which is a rare diseases also, which diseases we are addressing very aggressively. But since so many decades had got over, myself at least I say 18 years teaching and another 5 years UG, 2 decades I have seen. I have never seen that decay rate had decreased drastically. 20 years, I never seen that decay rate has drastically decreased. So my aim should be at least you create the awareness among the public. You try to reduce the numbers, and your research should be oriented towards clinical aspects. It should be oriented towards what way I can kill the microorganisms causing the tooth decay. What alternative medicines? From this, I saw an invitation. Ayush is there. From Ayush, there are so many alternative medicines. So now our central government has allowed us to utilize all the medications for any diseases. If you have a better medications in Siddha Ayurveda, you take it. If it's better medication in allopathy, you take it. You can give a sort of combined therapy. It is a certain oral diseases and all. No, I think that those who do dentistry or dental students, they can understand some lesions like oral lichen planus or some lesions like oral cancers and all. No, I have got so many medications from alternative medicines. Now, those are very potent anti-cancer agents we have from alternative medicines in Ayurveda, Siddha, or whatever way. So in that way, I am saving the life by using Ayurveda and other drugs for my own purpose. The ultimate aim is I have to treat the patient in a proper way, in such a way that they should get benefited. This is the one part. The second part, what I want to convey is educating our population, our childrens, and one more thing. This is an high time we have to educate the parents. The parents should know. Till now, none of the parents they don't know when to start brushing the kids. They don't know what kind of paste you're supposed to use for kids. They don't know what kind of brush they're supposed to use for the kids. They're not bothered about anything. So they bothered about all other what do you say? They bother about vaccines. They bother about diphtheria, tetanus, all this thing and all. So they bother about polio, and they have a very less knowledge how to prevent dental decay. And in this fastest world, no, you can't give the brush to the kid and ask the kid to brush. The kids are kids only. They won't behave like father or mother and listen whatever you say and go like Samatha. It will go and brush and clean. We don't. We will make bath there by parental care, but brushing will be under children's care only. So every parent should be educated that whenever some parents come to my clinic and say that my kid is having a dental issue, she is eating lots of chocolate, she's not listening, all this and that thing and all. Then I say that it's a problem of yours, not your kids. Your kid is not earning money. Your kid is not going to job. She can't earn money and get chocolates just because whatever you give, she's eating. If you won't have control over your kid, and they'll tell me, doctor, you say to the kid that not to eat chocolate. You say to the kid that they eat brush twice daily, all this and that thing. And a simple question I'll put before the parents that you just tell me how many teeth your kids have. Somebody they say I don't know, sir. So that's the care the parent is giving to the kid that they don't know how many teeth are erupted in upper arch and lower arch. Once if you started following the teeth, at least at the initial stage of some black color discoloration, they can bring the kid to the hospital or they can bring the kid to the clinic and we can advise the oral hygienic measures by changing the toothpaste, or if you want to do early filling, you can do early filling. Like we can see so many so many kids coming at the age of 3 to 4 with 8 decays, 10 decays, 12 decays. So I am forced to take all the kids under general anesthesia, and I do fillings. So for doing a fillings, taking a kid for general anesthesia, I get more stress because it's my responsibility to bring the kid back to normal ward. So here the awareness, educations, everything is lagging in my perspective. We are doing, but it is not reaching up to the level what we have expected. I'm not talking this topic this year or last year. I'm following it for 22 decades from a undergraduate till postgraduate. I'm having a clinic. I'm teaching 100 students per year and 12 postgraduates under myself. So the basic pathology is not addressed properly, and this is our duty to explain to the parents what exactly is happening, what you're supposed to do, and you conduct more number of camps in schools and camps in parent working area, and you just advise them how to prevent the decay. So this is the if you win in this particular portion of your target audience, the numbers will reduce. So I'm not saying you can't. It's a multi. You all know dental care is a multifactorial disease. I can't target. This is the reason for decay. If I know the single reason, I could have treated it long back. It's a multifactorial. Even it's not a single microorganism. It's a multiple microorganisms will play a role in dental caries formation. So I can't come with a vaccination. I can't come with a targeted drug therapy. I can't come with a targeted medicine for that. At least awareness and prevention, where I have to focus more, that will reduce the decay rate, healthy smile, good smile, and happy face you can see among all the audience. That's one thing. Second thing, in my career, I have focused in one concept. Focused in one concept. What the concept I focused is to reach the smiles to unreachable. That's my what I say. My tag word. In my department, I have a board outside to reach the smile. Reach the smile to unreachables. See, now I felt difficulty in conveying to normal kids. I felt difficulty in conveying to normal parents. I felt difficulty conveying this news via YouTube channels or TV interviews or so much of pamphlets or newspapers or whatever media I can't able to think. So once I got a thought that if this is not conveyed to the normal healthy individuals, what will the position for physically handicapped and special children? So that thought process came into my mind somewhere around 3 to 4 years back. So I had an opportunity to interact with visually challenged student. I have opportunity to visit so many visually challenged schools, visually challenged school, and hearing impaired and speech impaired schools. There was an interaction where I did a camp over there. Okay, I was interaction with some students. I was telling about oral hygiene and all. See, the visually challenged students, they don't know whether they carry paste over the brush or not. By chance, the paste fall off or fall down, they brush with their empty brush. That's the thing. Then they are not given in certain private. They're giving much care in certain things that are no. They're not given a proper care, so like they are not in a position to brush wisely. So none of the visually challenged people, they at least we as a healthy individual, we as a normal persons, we neglect the gum bleeding very normal. I don't know. We take it granted gum bleeding as a part of our routine excretion from our body, like a cold, cough, or sweat or something. And all. Some patients will come, sir, I have a bleeding gums. How means from 1.5 years I have bleeding gums. I have my face will become red, and I will ask, do you allow bleeding from your nose for 2 years, or do you allow bleeding from your ears for 2 years, or do you allow bleeding from your nail beds for at least 1 or 2 days? So they think that no, sir, when I brush hardly, I'll bleed. What do you mean? You just wash your face hardly, do your nose bleeds or your eyes bleeds or ear bleeds. That's a negligence. That's negligence. So whatever research you do, that's one side. Very dramatical improvement. It's going on in our dental field. It's very awesome. awesome means awesome way of I'm getting postgraduate student and getting research students. We have came out with we have marked molecular level. We have marked. We found the mRNA. We found the what exactly the causative organ for causative gene for cancer. All this in the thing and that. So I can't able to control gingivitis. I can't able to control dental caries. I can't able to control periodontitis. So if you just see early loss of tooth at the age of 25, 30, will it be a normal? And software staff wearing denture going, nobody imagined. Nobody gave that much importance to the gum care and teeth care. So same thing in visually challenged. So many things I had interacted with them, and they couldn't able to know. I was in a big dilemma in one day that how I have to address, how I'm going to address them, what way government is going to address for these people, what way I can really help them. See, when they brush, they don't know whether they have paste in the brush or not. When they spit, whether they don't know whether they're spitting blood in their saliva or not. They don't know whether the front teeth is broken, how much ever it is broken, or front teeth is getting discolored, or back teeth is getting discolored. They don't know what exactly is happening over there. Then I started chatting with them. Then they say that they used to feel with the tongue all the teeth and all, and they used to feel with the tongue about that cavity and all. And they used to say that sometimes when I spit, I can my saliva may be feeling a metal taste or iron taste or something. So these things and all, I got some sort of really enlightened version of myself that though these things has to be addressed. So with their help, I have got their ideas. I have got where and all they feel difficulties. So the concept of coming out with a dental awareness book in braille language that we have done 3 years back. I think myself and my professor Dr. K.N.K. Mastan and my co-staff Dr. Krishna Prasant, with the help of my college management and college chairman Dr. Sinesha Madam, we came with the first medical awareness book in braille language. None of the other continents they have this kind of concept for them. So I gave the book to the student. I first book was in English, so I gave the book to them. The teachers, those who teach braille, they read the book in a fraction of seconds, and they told that it's a awesome job you did, sir, and you did a very fantastic job. Probably they can feel what is happening inside me. At least that feelings can be expressed to somebody. So they have to convey that to the warden that I feel something roughness in my thing. So now I started teaching those caretakers. Like I don't call it as a wardens, I call it as a caretakers. So I have took a special classes for caretakers, and those caretakers are sensitized to diagnose a dental cavity, diagnose a gingivitis, diagnose a gum mobility. So once they sensitize, they're not going to treat. They're just going to give a call. I'm going to pick up and treat. So by this way, I'm just addressed hardly 300 populations. So then I translated that book and we came out with the Tamil Braille book also. Now Hindi Braille book is on the row, and I have conducted a national level program where I have translated all the dental awareness in all mother tongues, including those languages won't have scripts like Konkani languages and Assami languages and all. No, they don't have scripts. They can't read. There's only languages existing. But I want those people to understand what is happening, what exactly we are about to say, and what advice I'm giving. I can't neglect people surrounding me. So these kind of thrive inside myself. This kind of lateral thing, what I call it's a lateral thinking. So I'm not wasting my time. I don't say that I wasted my time. I'm earning money also in my clinic. I'm earning money from my college. I'm doing my own theory and practical classes. I use my postgraduates. My postgraduates used to help me. So these kind of parallel thoughts should be seeded inside your brain while while pursuing your academic course itself. So that has been addressed very, very gratefully. I've gotten appreciation letter from our current BJP president and former health minister JP Nadda sir that we are proud to you came with this kind of book, first ever book. And at that time, the same health secretary, Sir Radhakrishnan, sir, he told that we have told that a person from Tamil Nadu had attempted to write a medical awareness book in. So we thought that why can't I continue this in a series? So we kept it as a Helen Keller series. We dedicated this as a Helen Keller series. So we plan to come out with a braille book about first aid, braille book about menstrual hygiene. So whatever they want. So that's the thing I want to reach the principles. That's the thing. So say same thing I went and told about visually impaired and hearing impairment or speech impairment. Hearing impairment, I have asked my postgraduates to learn sign languages. They learn sign languages. They have conveyed the messages or conveyed the what is education pamphlets in the way of sign languages. So it was better way to speak with them in their sign language. They understood very better way, and they, after a post checkup after 3 months, they showed relatively a good oral hygiene status. Then I thought this is the way I have to reach that people, reach unreachable people. So you have a very big social responsibility. So I see two students of speech impaired. They're cracking the joke with sign language and they're smiling. That's I can't. I can't smile that way. So the language, it's not beyond the language. See, how your message is going to reach and what way your message is going to reach. It's very important. Okay. So that's a sort of social responsibility. It's a minimal. I don't want everybody to do this thing only. And this is a part of your academic or part of your job, because society had given a lot to learn, and it's high time for us to return back to society. Same thing I told. Who will allow? Do you allow your mother to extract a first year student, a second year student in college? Those patients came to us. So it's my responsibility. I have to do something in return. All the medical college patients thinking they don't know you are learning. They think that you are treating. So you should be all the medical fraternity students or all dental students or whatever medical people know. They should give the treatment at utmost care, not at the cost of patient. So we are in a position of life saving. So they are coming and they are helping us. In for that return, I'm just now returning back in such a way that whatever way I can able to do. So this is the second part. Third part, when I want to say that basically something what you say it will go off. Something what you speak, what you record, it will go off. What you write or what you register in your writing, that it won't go even after your period also. So I thought that I found so much of difficulties in studying dentistry. It's not, I know students also are studying, certain subjects are really like a nightmare for them. Even it happened for me also. Certain subjects I felt difficult in studying. I couldn't understand properly. Nobody is there to teach us or guide us properly. Though we are doctors and we are also students only, so that certain some professors were not very approachable for us, because of my interpretation that he is not approachable. Probably he will be a very good person. He will teach me nicely, but I myself think that why should you go and ask these doubts and all. So beyond that hurdles, I have crossed my undergraduate and postgraduate. Then I thought, why can't I write a simplified version of what I have studied? What I didn't understand, obviously my friends also did the same thing. So I have started writing textbooks. Then one more thing was in my mind during my education. So many textbooks what I have studied are from foreign authors. All the content are from abroad materials. All the studies, what they say, from Australian population, for American population, African population. This is common in Africa. This is common in America. This is common in Australia. All this thing, that thing and that. Then I thought, the India is the largest country. We have so much of dental. We are producing lots and lots of dental surgeons per year. Then why can't I give my own data to them? Why should they study those diseases which is not common in India? So like that, I have incorporated some things and I started writing 1 book, 2 book, 3 books, and all that. Like that, the book number has reached to 30. God's grace has reached to 39. Probably very shortly I will reach 40th book publication also. Then I used to think something new, novel. So one thing I got one day I was thinking about tongue. Then I was thinking, why during fever my taste is getting altered? Why this is getting altered? So I've done a review. So my articles among 170 or 160 publications, those articles would be not a big original research under something which I didn't get answer, for which I have searched lots and lots of books and find a answer. That answer I publish in a form of paper. So what way I can what way musical therapy and stress can release or increase the immunity level? I got an article. So like that, whatever you think, that may be a small thinking also. You just make it in a notes, whatever you feel like thinking. Somebody say it may be a stupid thinking, but one day you don't bother. You're not bothered about ourselves. You don't bother about others. You bother about yourself. You are going to be a master for yourselves. You do whatever you think. You just write whatever you think. The recognition will come later. It will surely come. So this is the part, third part. Then the next part. So that so many people will have an dilemma that so okay, I have completed my undergraduate in undergraduate. I have finished. Then what I do after BDS? That's a big question. What I do, whether I should do postgraduate, otherwise whether I should do some other thing. But they have seen so many people. They did uh, dentistry and they've shifted their job to medical transcoding. And they've shifted the job to software industry. So I don't find fault in them. What I feel is I find they have not realized themselves and they have not realized their own potential. They have not realized their own potential and they thought that I am not fit for this field. Once you realized your own potential, you are very well into this field. You are very well managed with undergraduate only, without postgraduate only. You can very well earn a good amount of money and all these things and that. So either nowadays so many fellowship courses have came. So you can do either pursue or postgraduate. Even the postgraduate also, the 10 years back and all, which specialty of postgraduate is very, what is it, very attractive. So I take clinical, I take non-clinical, I take this branch, I take that branch, this branch and all. So in that condition, I feel that whatever comfortable, you all know oral pathology, I am comfortable with oral pathology and I'm doing a lot in my oral pathology. And being a oral pathologist, I had a lots of contacts with general pathologists, oncologists, neurosurgeons, at the team, and I got a very good array of friends in medical fraternity. So it took time for me to prove myself. Once I proved, automatically I have been picked from every hospitals and picked from every colleges or this and that thing and that. So now sort of things apart from awareness, apart from all these textbooks, apart from social service, if you come for your pursuing education, so it has newer thing. What I see is forensic odontology or forensic dentistry. We are very much behind in forensic dentistry. There are so many fellowship courses in forensic dentistry. Here in mass disasters and crime investigations, dentist help is not utilized properly because we handle with the teeth prints and lip prints and bone face. In other countries, as UK, US, and European countries, and also any disaster for face identification, that face will be identified with the help of dentist only. In the team, the prime team, those who go inside the area of mass disaster, 100% a dentist will be there. 100% and radiologist will be there. They will take the X-rays. They will see the skull. They will see whether it's a male or female. There are so many opportunities here. Recently, from Arushi murder case and some other cases and all, the dentist things have been utilized. The dentist knowledge have been utilized by seeing the bite mark of a person, those who involved in Arushi murder, and saying that he has a milk tooth. He is a juvenile person. He can pick up in juvenile cell, not in adult cell. So he had escaped from the life sentence. So many things had happened. It's happening over here. Then you can, if you want, you can go for master in clinical hospital management. You can and you can go and there are so many corporate heads out there. You can go and sit as a head of a corporate hospital, and you can do a you can see the dental wing of that institute, and you can do some sort of genetics or molecular biology courses, and you can do a research. Nowadays, nowadays PCR became a common lab instrument in hospital. 3 years back, hardly in Chennai, I think hardly some 7 to 8 PCR machines will be there. We have to send it to Bombay or Bangalore or Delhi or some other places. Use a PCR now because of COVID. No, the PCR is some sort of a hemoglobin assessment kit. Every lab they got a PCR. So you learn yourself about molecular biology or basic genetics or all this thing and that. For this biomedical or biomedical science, they won't ask whether you're a dentist, whether you're a medical person. They want a person with medical knowledges. So this is a very big world. So as a dentist, no, you can sit in a COVID OP. You are capable of taking a smear, and you are capable of putting a smear. You are capable of reading a smear, or you're capable of taking a samples, and you can read. And this pandemic situation, it has opened new opportunities. It has opened new opportunities, not as a regular practitioners. I think I do say that from past 3 years, dentistry, because to be very frankly, the government has announced frontline workers, frontline workers, frontline workers. I just want to say that among frontline workers, dentists will be there. We are the only crowd of doctors who has to remove the mask and see the patient. Apart from us, each and every doctors will ask them to wear the mask and sit. We are the one who keep our face very close to the oral cavity, and we are more prone for transmission of COVID, whatever variant it may be. And we are the one who handle saliva because that's our daily bread butter and jam. So I feel that industry is a noble job, a noble profession in pandemic days. In spite of see, everybody are running away saliva, and I'm putting my hand inside my saliva. Everybody are running away. Those who are not wearing mask, and I'm putting my head inside the oral cavity, or very close proximity to the oral cavity, and checking what are the diseases, and I'm addressing diseases. I'm more prone for aerosols generated over there. I'm very more prone for high risk, very high risk. I do say ENTs we have, but we directly in contact with saliva, So now government has given a proper protocols for everything, and how to protect yourself, how to the immunization protocols, and how to put a face shields and masks and gloves, and you can start seeing patient. Nothing like that. See, so many people are getting scared about the pandemic, and they're thinking how I should practice dentistry, how I should practice dentistry. But to be very frankly, I'm one among not one. I'm one of the few dentists. I'm that one dentist who I never closed my clinic, not even a single day during pandemic, even first wave or second wave or third wave. First wave it was safe to me. Why safe to me means that time the case in Chennai was hardly 7, 8, 6, 17, 18 only. At least now I have to think about 25,000 cases, 30,000 cases, second wave 40,000 cases and that. So that time, basically, as a dental surgeon, I have my own protocols. I have my own sterilization protocols. I have a double layered mask. I have a face shield. I have a gloves, and so we come across number of unrevealed tuberculosis patient. We have come across with number of unrevealed HIV patient. We have come across with number of unrevealed viral load patients. But once COVID comes, we're very scared. We have to be scared, but not scared. Scare yourself too much. Just be cautious, and you just be what do you say? Just be planned. You just have a plan what I'm going to do, what I'm going to execute. So once I have the thank God that before the pandemic in Chennai government and Chennai corporation, they have made us to register in medical establishment act. So I had a group of doctors from government. They visited my clinic. I have a separate waste disposal protocol, firing machine, fire extinguisher. Then I have a lot of serious protocol. They went and verified. They told that your clinic is well enough to handle any kind of patients. They gave a certificate. So I was prepared before COVID. So I know what I'm doing. if at all, if you are scaring, you think all the patient as a risk patient only. You treat all the patient as COVID patient only, then you will be safe. There's nothing going to be um, benefit you when you sit idly at home. Once pandemic goes only, I'll go and practice. Once pandemic goes only, I'll go and do. Once pandemic goes only, I'll go and touch the saliva. These things and all, you don't have to. What I want to say, you don't have to stress yourself so much. It's nothing to stress yourself. It's just like a disease. It will be like that only. After 2 3 years, no, we used to say this in history that 10 years back we had a pandemic. It's called as COVID. It was like that. It was like that. It was like that. We will tell stories to other generation people. So these things, I think I am just covering what after dentistry during your practice, I want to say only two things: patient listening. Patient means what patiently listen what patient says. That's the only problem what patient faces today. Sir, whichever doctor I go, whatever I say, they are not listening only. Let them allow them to speak for 5 10 minutes. That's the success of your practice. When you listen what patient says, when you keep quiet, when you listen and replay for them, thereafter this is get cured. They feel that they're in a comfortable, they're in a safer hands. So you just listen the patient's complaints properly, and by chance, if they are misunderstand some treatment procedures, you just rectify that. No, this is not like that. It has to be you misunderstood this concept. Then you just try to change them. Then do your job genuinely. Think patients as your relatives or or your own father, mother, or sister, like that, and be polite. And the way of handling patient is very important. We are also human being. We used to get stressed. When I get stressed, I stop myself working. That day I stop my patients. So they are not coming to me paying money and taking my being my stress busters. So I'll stop that day patients. And so the awareness is very minimal among patients also. They will sit on your head and they will command and they will demand you should be in such a position. No. This is like other health ailment. This is also important. You have to take off. You have to take a leave for scaling purpose. It's nothing like that. I have to do the treatment now only, today only, tomorrow only. So you are the person. You are going to explain what's the treatment, and you are going to train their mind how to behave with the dental surgeons. So this is very important. We have we If we give much space for patient, we'll be like a doctor. So you do sincere treatment. You tell them, I can't do 5 6 scaling extraction. You have to do in morning. Do this thing. Do for regular checkup and all. Do all these things. Patient will listen. If you are not commercial, if you tell what exactly they want, they will listen to you and they will ready to pay whatever you ask, and they feel comfortable that it is worth paying for your knowledge. So what I personally feel is you don't have to satisfy patient. You have to satisfy yourself, and you have to satisfy medical ethics. You are charging for your medical ethics. I'm happy to charge a consultation fee of 250 rupees without writing a prescription. So I'm confident that I'm saying you don't have the disease. This is just you got scared. Don't get panic. You go. This is not a big disease and all. Do some warm up gargling. Get the fees. So the other part, what patient expect? No. I went to doctor, but doctor didn't even give any tablet. He didn't even give any medication, but he got the fees only. So just because those talks, you don't underneath yourself and write unnecessarily antibiotic, unnecessarily decomplex tablets, unnecessarily decomplex injection or something. So your knowledge is your amount, what the fees you are going to ask. So don't scientific patient. Just because the patient comes, no, I have to put injection. Once I put injection, only the patient will pay. Don't imagine like that. You train your patient. Since the patient went for 10 doctors, they can't able to diagnose the disease. If I come and diagnose that disease, and starting at the starting stage itself, if I cure the disease, no, I'll get my charge. So be frank and be practical and be explain. The patients will listen whatever you say, but we should be speaking the patient's language, not your medical terminology. If you talk in a medical terminology, they think that the content won't reach the populations. I think it's already 1 hour, 10 minutes got over. I think I've covered a basic things about what are the path I have walked and what are the difficulties I faced, how I overcome that, how I can able to shine a little compared to my colleagues. How you should I want you to be a smart thinker rather than a hard worker. You think smartly, work hardly, but think smartly. So my best wishes to everyone, my best wishes to the team also. I request the moderator to take the mic and by chance if any questions from audience, I'm ready to answer, madam. Madam, uh, madam, may I take some questions, madam? I'm ready for questions. If anybody have questions, I can answer. You can unmute yourself. Madam, if anybody wants to ask questions, you can unmute and ask. So let me, if you want go into academics side, more towards academic side, um, probably I will emphasize you to more concentrate towards basic histology, basic anatomy, and pharmacology. So if you are sound enough in pharmacology, basic histology, and anatomy, it's easy for you to handle all the things. So when you know the basic histology of anything, basic histology is what is a cell, what is a tissue, what is the functions of cells, and what is the physiology of the cells, and what are the things. Once if you know the basic histology of each and every structure of your teeth and surrounding structures, then only once if you know normal only, you can identify abnormal. If you don't know the normal, it's difficult for you to identify the abnormal. So try to see more amount of normal tissues or normal tooth or normal patients. Then only you can able to identify abnormal. So you try to learn about normal anatomical landmarks or your normal anatomical structures in your oral cavity and in your radiographic images. Nowadays, apart from radiographs, we came with CBCT and computer tomograph and whatever things, CT, CT, MRI. So we should know the basic basic anatomy of normal and abnormal. So if you don't understand about normal anatomy of maxillary sinus and other spaces, you can't differentiate that with pathology. So if you know the normal histology and normal anatomy, then only you can read about pathology. One more thing is pharmacology. Why pharmacology? Pharmacology is the basics drugs. You have going to deal about drugs. You have to know in detail about what drugs you are supposed to use and what are the side effects of the drugs. So this pharmacology should be updated in a regular interval or a frequent interval. It doesn't mean that I have finished my undergraduate or I have finished my postgraduate. I have to stop my learning process. So this pharmacology, every day we are coming out with newer drugs and newer materials, newer actions. Simultaneously, every day they are proving, some theories are proving that this drugs concept is wrong, that drug concept is wrong, that is wrong. So the upgradation of knowledge and updation of knowledge is very important. Even when you see about dental caries, somebody will say this is the older theory, this is the newer theory, and like that. When you talk about sensitivity, this is the newer theory and older theory. So once if you are not updated with the recent concept, what it is happening, you can't able to address the disease and you can't able to give medications for them. So basically, you study the anatomy, physiology. That's very important. Then you study about histology of everything, each and everything. Your teeth, buccal mucosa, oral mucosa, and every basic histology, you should be thorough, and you should be in a position to see and say it is normal. It is not abnormal. For example, I'll say one incident. Posterior part of the tongue near to the sulcum terminalis, there are normal anatomical structure called the circumvallate papillae. There are some 78 papillae in a reverse V shape. It has been arranged in a small growth. It is arranged. So some training students, some resident students, they see that during oral examination, they found that that is abnormal and they have referred the case to me, Dr. Arvind sir. I have seen small swelling at the posterior part of the tongue. May I know your opinion? So that time I know my students or our students has been trained in such a way that those anatomical structures are normal growth only. So we have not applied our knowledge to see circumvallate papillae. So we can't see foliate papilla or filial papilla or other papilla. We can't able to see the papilla in patients. So you try to see the normal, whatever patient, for whatever reason they come to you, you address for the lesion, or address for the TK, or address for the extraction, then see other palatal region, palatal rugate, tongue, cranial attachment, and everything. You have to have a better idea what exactly is normal. So if you see 10 to 20 or 30 normal cases, by chance, an bifid lip or a cleft lip or cleft palate or some sort of anomalies or tongue tie comes, you should be able to identify either it's normal tongue frenum or normal labial frenum or a tongue tie. So once if you're able to find is a tongue tie only, you can able to treat and that will relieve from psychological relief. So that will hurdle, that will obstruct the speech process. So basic histology, anatomy, pharmacology is very important to pursue your dentistry. Though we have an option of studying about the dental materials, then you study about conservative dentistry or general medicine. General medicine is very important. General surgery is very important. Though you don't do general surgery, general medicine, pharmacology, you should know all the vital organs functions, all the vital organs, normal values, all the vital organs, physiology and pathology. If you don't know the normal vital signs and normal vital organ signs and symptoms, we can't manage the patient. So, for example, if a hypertensive patient or cardiac patient comes to you, if you know the normal BP value, if you know the normal diabetic sugar level value, or normal serum calcium level value, then only you can able to treat the patient. Then only you can able to diagnose the patient. So we can't keep on referring the patient to refer to cardiologist, refer to gynecologist, refer to diabetologist to get an opinion. Some people they go and come. Some people they basically will think that you are making them turn around you for twice or thrice. A patient suffering from pain, at least you should know the normal BP level, you should know the cardiac level, or at least you should know the pharmacology, means whether the patient is under any anticoagulant therapy or not, whether the patient is under any other medications or not, whether these medications are going to interfere with my medications, or whether these medications what they are taking are going to interfere with the treatment positions like anti coagulants and all. No, you should know the basic knowledge what I'm supposed to do and what I'm not supposed to do at the particular time. Whether this amount of diabetic level is normal to take for extraction or not normal to take for extraction. Whether this much amount of respiratory count, whether I can normally I can take for extraction or not for extraction. And you should have a basic knowledge about the medications given for other systems too. Patients comes with prescription, so you should be in a position to see what are the drugs they are taking. By chance, nothing wrong, you Google it and get a knowledge. Then you can try to convey them. You are taking this kind of drugs during this anticoagulant therapy. You are not supposed to remove your teeth. Just take medications, take antibiotics, wait for 3 to 4 days. You stop your drug for 4 to 5 days. Then you remove that teeth. So that you should be aware of these things. And one more thing is you should be thorough in facing the complications to face the emergency arising in the dental chairs. So you should be equipped with the emergencies arising in the dental chairs with all the basic medications in your clinic, and you should be thorough. You should be having a plan which is your patient, which patients you are going to do, whether the patient is suitable enough to undergo your treatment plan or not. That's the basic treatment planning from chief history, chief complaint, past medical history, past dental history, whether it's a patient is allergic for local anesthesia, so allergic for any drugs. So these kind of things are very important to for further treatment. So just because without knowing the allergies, you give the same tablet for the patient, if he's again landing in anaphylactic reactions or allergic reactions, it's very complicated to manage. So you just try to build up a rapport with the general practitioners around your clinic or around your place. You just have a general talk with them. You can try to refer them for opinion, let them refer them for you, and you try to, if needed, you try to take a history. For example, like a bleeding disorders like hemophilia, so there are patients with hemophilia, they just ask the case history. It's a matter of few minutes only. You don't have to waste an half an hour time or like 1 hour time how you take case histories in oral medicine or oral surgery. The moment when your patient comes itself, you just interact with them. The interaction with patient itself is a sort of case history technique. The patient, when it comes to inside the clinic, only you see about this walk, gait, whether it is built, normally built, whether it is fatigue, whether it is taking a short breath or a deep breath, or whether he is oriented or not oriented, and you just ask him, and they may hide. Obviously, they may hide about that disease. They think that if I say hey, diabetes, doctor won't remove the teeth. If I say cardiac problem, doctor won't remove the teeth. In that conditions, you have to go inside, talk with them, and bring out the truth. Because obviously that they would have a bad experience. They would have went to another dentist. They would have rejected. No, I can't extract that tooth because you have cardiac problem. I can't extract the tooth. You have your diabetic level is very higher. I can't extract the tooth. You are epileptic, or I can't extract the tooth. You are renal transplantations. So, what are the medical complications? How to handle transplant patients? How to handle diabetic patients? How to handle hypertensive patients, and how to handle psychiatric patients, and how to handle special children. When you are equipped yourselves with these kind of programs, it will be easy for you to treat the patients. So the patient will get 100% of satisfaction. Then with this 100% of satisfaction, they can go with the treatment plan. Then one more thing, what I want to insist, like academically, it means see, whatever textbooks says that cannot be there in the diseases. I used to say my students that only you read textbooks. Diseases won't read textbooks. Diseases won't read textbooks. Every diseases may vary in some degree of alterations. You don't see the classical future. What you read in textbooks will be there in the patient. The classical way will be there in the patient. So that may vary differently. Each and every patient, what you see is a new patient. Each and every patient is a new patient, and each and every cases or each and every extraction should be a new extraction. So there are so many things which you have learned in textbooks. You will be learning in your day-to-day practice. So don't stick on to your textbook knowledge and expect the same thing in your patient. So if you read something, try to acquire knowledge through patients. So the patients will be your textbook. Once after your course, the patients will be your textbook, and you can learn a lot from patients, and you just apply your knowledge and give the treatment. And you can't expect exactly the same thing what you read in the textbook in the patients. That's why practicing is different. So you should be confident enough to manage all the complications arise during your practice by your theoretical knowledge, by your practical knowledge, by your knowledge of reading or updating things. If you don't update yourself, it's difficult to treat the patient in a better way. Whatever it may be, updating drugs, updating in diagnostic aids, or updating in your instrumentations, or updating in your treatment modalities, when to use CT, when to use CBCT, when to use PET scan, what investigation you can do. So these things and all, if you don't update yourself after your studies, it's difficult to cope up with your competing dentists or competing practitioners. So we just keep updating through journals, through magazines, through online, or through some YouTube videos, or whatever you feel like doing. Whenever you free, just go through and update yourself for your better clinical practice or better hands-on training. Do attend a few hands-on courses once in a while, once in 6 months. Update yourself in recent concepts. So update yourself in a sort of knowledge improving procedures. So update yourself in joining some hands-on trainings, which is organized by some sort of private organizations. You just listen to some sort of newer knowledge updating programs and all. So like that, we have to improve our program. So again, I'm telling if all the participants, those who are listening, if you have any questions, you just be ready with the question. We can go with the interactive session. I'm ready to answer whatever questions you have, both academically, because I'm not. We have not introduced ourselves. I don't know how many of you are at which level. So depending on your level, I can address specifically. So if you want a specific question, a specific answer from me, I'm ready to explain. I think I request organizing team to start the interactive session now.
Then you can ask any question. Sir is available only for us, so please don't hesitate. Type whatever questions you want.
You can unmute and ask anything. If you want, you can
If you're
type in
unable
chat.
to unmute, yes, if you're unable to unmute, you can send me the chat and I can read it out for you guys.
You can ask regarding treatments, academics, research, publications.
behalf of them, I would like to ask a question. So they are like newly entering field of like practical implementation. So can you please explain something about implants and how it works exactly?
Madam, can you repeat your question, madam?
So actually, few people are just stepping into their practical implementations. So I'd like to know about implants and its procedure and how to work on it.
Yes, 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 yes. See, I think I don't know whether the question is from a practicing dentist or a student, but let me answer. The implant is a recent boost. I think it's a very good option to learn implants because we in India we have started placing implants in a very late stage. In abroad and all, more than 40, 50 years, they started using implants. They that the probably the cost is covered by insurance, so they are going for implant easily. Here, implant is become a part of our curriculum from Dental Council of India. When you are pursuing your postgraduate degree itself in prosthodontia, MDS, in periodontia, and in oral surgery, they will teach you how to place implants. That's for postgraduate. Okay. Then there are so many other private, what is it, private academies. They are teaching how to place implants. Then there are so many implant companies. I don't know how to mention the trade names. They are also conducting how to place implants. So it's better to learn the procedure of implants. It's not a big rocket science. That's again I told you. You should know basics about the bone, whether the bone is quality enough, the bone is hard enough to adapt your implant. So implant, it's the treatment in future. It has a very good anchorage and it has a very good procedure for giving a near to nature force of chewing habit for patients. Either you can give a individual tooth implant, or you can give a complete fixed implant, or you can give a implant supported complete denture. So this is implant course. It's very much simplified. For example, in the 3 years course became a 3 months course. In 3 months, they will teach you how to place implants and how to place the crowns and where to buy the implants and what are the instrument you need to place the implants. So previously, the implants nothing but we are used in orthopedics. We place plates and screws. There itself, they have used the implants to plates and screws long back. Here in maxilla and mandible for fractures, we are using implants. Now we are using implants for chewing purpose. It's a nice option, nice to open. So you need not be a surgeon to go into a implant process. You should be a dental surgeon with a basic knowledge and basic histology and pathology about the normal bone. You can learn about implant and you can pursue implant. It is very nothing difficult in learning it. It's very easy. You can learn and you can place. And there are so many companies coming nowadays. So you can get it in a very competitive prices. So the implant rate will be a bit lesser in recent in near future, and it's a good option of learning implant, madam. I support if you are where an opportunity implant, you study postgraduate, and if you can't able to do postgraduate, you go for some centers where they teach implants. Just check whether the implant is what I say. It's some sort of well-renowned company or universally accepted company like that. There are so many people they will make implant and they will give the course under. So you just see the academy, go and join, learn. It's easy, good for financially cost wise also you can improve your cost. Next question, madam. I think one more question I got. Can you read, madam? After course
Yes, sir.
going abroad.
After completing BDS, going to abroad to work, is it the best move or not?
After completing BDS or MDS.
Yes, sir.
After
BDS.
completing BDS, going to abroad and okay, fine. That's a good question. But the thing at the current situation is the degree what we are obtaining from Dental Council of India, it is not officially approved by any foreign countries. United, sorry, USA. European countries, or European countries nowadays they are considering UK also. UK. Our degree is valid in Sri Lanka, Singapore, Malaysia, all these things. Now there is an option open in Germany. If you're interested, you can go to the websites related to Germany. In Germany, they are giving you a 4 or 5 years course, like a one year language course and 3 years postgraduate course. That's a full time residential course. You don't have any theory classes. You will be allowed to work in Germany. In it, you can apply. Recently, I've advised, I've guided a few students. They can go to Germany and they can do their work over there, work and learn, not study and learn. Here in India, we study, we do practicals and learn. There you do practice, and you learn. And there won't be any teaching modules for you, and you have to learn and you have to come and do your works. After 3 years duration, they will give you a degree of master degree of whatever field you want, surgery or endodontia or whatever prosthodontia. Then they are giving you an option to work over there only. So the Germany option is somehow working for past 5 to 6 years. Otherwise, you can work option. It is not a big in other countries and all. You have to go outside like Canada, Australia, New Zealand. You can pursue your higher education and you can give your examination. You can study your post graduations. Once you study your post graduation in Australia, Canada, or New Zealand, your degree will be valued throughout the world. Again, when you come back to India, you can't. Your degree is not valid in India. You have to write an exam, then you have to come and work. So the thing is now probably the globalization word, it really means that one degree in India should be valid across the world. So here we don't accept other country degrees inside our country. They won't accept our degree inside their country for practicing. For practicing, they will examine you that you are qualified enough to touch their citizen. Here only in India, we welcome abroad doctors very easily. We say that we are going to see the doctor is coming from abroad. He's a very great doctor. All this and that thing. There, abroad doctor means you should get license in the country, license in the state license, and the hospital license. They won't until otherwise necessary. They won't allow you to touch their own citizens. So job means European countries. You can take the option. You can go in website, job and postgraduate together. So you'll be paid during the 3 years course also. It is there for MBBS, it is there for BDS also. That option you can go for job option in European countries, either Germany or Frankfurt or any places. But for that you should complete Germany language. 1 year German language. The course will be in German language after BDS. But that's what only. Any other questions now?
So we have another question.
Yes, ma'am.
If patient wants to replace the missing teeth with implant, kindly elaborate the procedure step by step. How to proceed and plan. Kindly elaborate the procedure step by step and how to proceed. This is what they have asked.
Okay, it's some sort of vague question. I don't know whether the patient, what age, I don't know, but I'll answer the question. For example, the patient comes with a missing tooth. So any missing tooth, the patient comes to you, you just keep in mind a basic question you're supposed to ask. That is a normal loss or extraction. Okay. For example, if it's a normal extraction, it is okay. Or if it is mobile and lost in during younger ages and all, you should think about your supporting structures. Okay, then leave it. We just assume everything positively. A 25-year male patient tentatively came to you with lower incisor, upper incisor extracted. You want to place a implant. So okay. Then the thing is, there are two procedures. One is immediate loading implant, one is delayed loading implant. Immediate loading means the moment you extract the tooth, you keep the implant into the extract socket. You just dump some bone graft material over there, suture it. So leave it for few months. In that few months, the bone will get osseointegrated and your implant will be fixed tightly. So after second phase, you can put a crown over there. The delayed procedure is extract the tooth, leave the patient, ask the patient to come after 3 months. After the complete healing, you place the implant. Okay. Once if you want to place the implant, you should have a radiographic image. Why radiographic image means how much is the bone thickness? Whether the bone thickness is sufficient for me, the bone length is sufficient for me, or is there any anatomical structures passing through my way of implant? Anatomical structures in the sense of any mandibular nerve or mental nerve or nerve canals or roots or nasal floor or orbital floor or maxillary sinus floor. This has to be diagnosed through X-ray, first thing. Second thing is, this can be confirmed either with CBCT, bone beam tomography, and they will give exact width and measurement of all the bones, like mesodistal, labiolingual, how much width in all the sides. So you can plan your implant. If you have a 5 millimeter space, means you can place 3 millimeter implant in the depth. So then you either you call your consultant to place the implant, or you if you learn to place the implant, you can place. Or in some companies, those who are selling implants, if you have a basic knowledge, they will come with a physio dispenser. They will come with a implant. They have a team of surgeon. They will come to you and they will teach you and they will fix the implant inside the socket. Okay. So after fixing the implant, check the X-ray whether what the implant what you have placed is exactly landed or not. If it's exactly landed, just send the patient with proper antibiotics for 5 days, allow it for heat. Then after 60 days or 90 days, take an X-ray, see for osseointegration, and put for a cap. This is the conventional type what we are doing. Now, recently, very easy procedures are here. So many companies, they came with guiding procedure implants. What exactly means? You have to take the X-ray, you have to take the model, and you have to take the CBCT and send it to the company. That company will guide you with a plastic sheet with a hole where you're supposed to put your implant. Just put that sheet on the arch, either upper arch or lower arch. They have a limiting in that hole. So you don't perforate at all. It will guide you easily. But thing is, your cost may be expensive for 5,000 or for 6,000, but it will easily guide you. So without any guidance, you are not going to perforate the bone. Exactly, that guide will help you in placing the implant. That is very easy. So if you have a basic knowledge about bone, whether it is a cortical or cancerous bone, whether it's a thick, whether it's a pathology is there or not, then you have to ask about systemic disorders, whether it's diabetic or some other systemic diseases. Then you have to check whether smoking, because these things, it's not contraindicated, but you should ask the patient to be cautious when you're putting implant in smokers or when you're putting implant in diabetic patients. This guided implant are very, 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 very safe, and it can be easily done in normal clinical. It is very time saving also. This can be taught in everywhere, and all dental implants you can place in the guided method. Either conventional method you place with a physio dispenser, or use physio dispenser with a guided splint. They call it a splint. You can fix the splint over the teeth, and they have a proper opening. In that opening, there is a mark. So beyond that mark, you can't drill only. So it's a very easy procedure to put the implant. Any other questions, madam?
Guys, do you have any other questions?
Good evening, sir.
Yes, good evening, madam.
Sir, my question is not related to any MDS or anything, but I really wanted to know, if you don't want to do MDS, is there any other career options after BDS that will be helpful for us to sustain?
No, the thing is, I got a question, but you have to decide you want to be a practitioner or a non-practitioner. You want to become a practitioner or non-practitioner.
Sir, if I want to be a non-practitioner, then what are the fields that I can go for, sir? Like,
That's simply no, non-practitioner means as I told you can go for forensic odontology, MSc forensic odontology, and you can go for fellowship in forensic odontology. That is the more upcoming field now. The forensic odontologists, they are going to rule. They are going to have a very big scope in crime investigation, crime identification. That's one part. The other part is you can take a MSc genetics, MSc molecular biology. Okay, MSc epidemiology you can take, or MSc diploma in public health science, DPH, public health you can take. So this DPH, public health, community medicine, MSc hospital management and all, you have a good scope. This public health and epidemiology, you can have a job opportunity in central government, and you can job opportunity in medical planning. You can have a job opportunity in World WHO and all, where you are the epidemiologist. You are going to give the statistics, like how we are giving a corona statistics and all. No? There you're going to say statistics, and you are going to plan for the treatment. So this kind of MSc epidemiology program is there. Genetics and molecular biology is totally into the research. You deal with genes. You can put a lab, genetic lab, and you can find a genetic analysis, and you can give exactly what is responsible, what gene is responsible for the disease, and you can probably after 2-3 years you can actively participate in gene therapy. Gene therapy is a targeted type of treatment given in the targeted gene itself, correct the gene anomaly there itself, and allow the chromosome, allow the cell to perform well. So these are the things non-clinically, academically, forensic odontology, MSc. In that MSc genetics, MSc molecular biology you can take, or you can go for some sort of nowadays so many cosmetic and aesthetics are came. The aesthetics again comes under clinical. You can have a aesthetic course. It's a 3 months course will be there. Otherwise, a fellowship course is there. You can take. But clinic wise, if you want to do BDS, not MDS means you just equip yourself with some sort of fellowship, endodontic therapy or implant therapy that will support you in your day-to-day practice. Anything you want to know?
Thank you, sir. Thank you. And
Yes,
also, sir, I have heard from many other graduated BDS students that they're going for corporate jobs.
exactly, exactly.
Yes, sir. Like, pharmacovigilance and all that. They say that is some emerging field, and after 5 years, they have, a good future in that particular field. So I'm really
No,
out
no,
of knowledge
no,
about
no, no.
all that, sir.
I'm just. I want to tell you a few things also. There is a separate course is there. You study that course in pharmacovigilance course is there. MSc pharmacology and toxicology course is there. One of my student after doing undergraduate, he is doing pharmacology and toxicology, but not totally into the software like medical coding or doing BPO job under. You do whatever other than software people does. Either you do pharmacovigilance or you go for pharmacology and toxicology. That's pharmacology and toxicology. Again, it comes to forensic medicine. So forensic medicine, it has pharmacovigilance, pharmacology, toxicology, forensic odontology, everything is there. So once the government pick up, sensitize the dentist can do these kind of jobs in a better way, then we have a very good future about. See, for example, if government doesn't know that dentist can do pharmacovigilance, a dentist will have a knowledge of pharmacology and toxicology. How come they give a job? They can't give a job. The thing is, you just do your course, prove yourself, and get job over there.
Yes, sir. Okay, sir.
Yeah. Yes,
But
ma'am.
sir, if that is a corporate job, that will have nothing to do with what we studied in UG, no, sir. Like
No, 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 no.
this.
Nothing to do with it. You're not going to do this. What you study in UG is to practice. You're not going to practice. You are totally into a different field. For example, you're going to be in a different field. No, for example, my student doing pharmacology and toxicology. So, what will be his work after finishing is he is going to design the animal study house. He is going to design animal laboratory. He is going to design what feed we can give for animal. He is going to design whether the paste what we are giving will be a toxic for oral mucosa, or the mouthwash what we are giving, if you're keeping for 5 minutes, what plasma concentration or what saliva concentration, or if you're keeping the mouthwash for 30 minutes, what is the saliva or plasma concentration. So this will be his job. It's totally different job. We can enjoy the job. That's it.
Okay, so it will be related to our field only.
Our field only. Our field only. So if you do it in our field only, that you have a good. What do you say? We have a great good job opportunities, because doing in other field there are so many persons are there. Because I don't know anybody to say that. For example, if I give a sensitivity toothpaste, I don't know how much time I have to apply over the tooth. So I want my person from my field to study and tell I can keep the sensitivity teeth apply over the tooth for 5 minutes or 3 minutes or 2 minutes. After mouthwash, I should gargle immediately or not. So other people don't understand that. So you be unique, and you have a lots of option over there. That's I only made him to join that course. You'll be the first of its kind. You'll be a pioneer in this field. So you don't go beyond others what they are doing. You set a path for you and walk on that path. This is very very good, but do in your field only. I can tell you do forensic medicine. I'm not telling forensic medicine. I'm telling forensic odontology. Skull identification. Let us stop with skull identification, face identification, crimes identification, lip print, teeth print, bite marks, everything we can do. Anything more?
Okay, sir. Thank you so much, sir. And
Oh, fine.
um, also, I was thinking about people going into army field or doing UPSC after dentistry.
Yeah, they are. I have. There are in Pondicherry government medical college. There are two seats for army seats. They through army they'll go army. They'll go join in armed forces. They will do job over there, and they have a PG quota over there. Once you've completed few years of course, no, the army will make you study postgraduate. There are seats in Pondicherry. There are two seats for army persons. There I have I went as examiner. I have in they were in the post of colonel and major post they have. So after doing oral pathology or whatever thing, they are like a frontline workers. So they carry. He used to say he carried dental chair in his shoulder and he'll go for war front, but not like army hospital. These people are trained intensively to take it's like a school bag. They will take the dental chair in their bag, which will weigh somewhere around few 70, 80 kilograms, and they will walk over Pakistan border or China border. They will do the work. They will treat trauma, or they will do whatever things they want to do. That's also there. That's there from long time. If you're interested, you can write UPSC and join in some railway hospitals or army hospitals. You can do.
Thank you, sir. That was
You're
really
welcome.
very helpful.
Welcome. Welcome. Any other questions? Sir?
Guys, do you have any other questions? Wait for 1 more minute. If you have any questions, please drop down in the chat box.
You can feel free to ask anything.
Sir,
Yes, ma'am.
sir, as far as I know, many of my seniors they said me that dentistry is a very unstable career, and only if we have a particular knowledge in any of the field we can come up in that. But what I was thinking, could you explain me of various other things that we can do after dentistry other than doing the masters, like other fields, like we have to explore more. So
No, the same question were asked previously. I can understand your question. but you can ask your friend that every field has that same state only, not only dentistry. It's not no certainty in software field also, not in medical field also. At least dentistry we are very safe than general medicine people. Okay, so what other
Sir,
field means?
but actually, they say more than dentistry in India, dentists in abroad are actually like that is more
Earning.
good if you go abroad. So, like, if you finish dentistry here, it's better that you don't practice here. You better go to abroad. That's what the advice I get from everywhere.
No,
So,
that's I don't say that's a good advice. That's that perception. I can't say. My perception is see you're from which college, man?
sorry, sir.
You finished your course or you're pursuing your course?
No, sir. No, sir. I'm a second year student.
Second year students, fine. That's then I think another 3 years probably you may give some advice for your juniors in different way. So it's good thing you can go for abroad. Nothing wrong in that. Same thing I told you. When you go for abroad, you should be prepared yourself how to go abroad. You should be like you have to be academically. You just concentrate more on academics. Then after finishing academics, you have to prepare exams for their own countries, entrance examinations. After preparing their own countries examinations, then you pursue their DDS or some other degree, which is highest degree, where you can practice in UK and USA. You get a very good amount, very good thing, everything. That's fine. That's a very good thing. And apart from going from UK and USA, I've told you have an opportunity to go to Australia, Canada, and New Zealand. That's second chance. The third chance, I have told them you can go for Germany, where you can pursue with this Indian degree. You can pursue a master. Along with master, you can earn money and do master degree, and you can get a job over there. Whereas in other countries, our degree is not valid, so you have to go and do their own entrance examination. Then only they will pursue you to study or practice. Once you practice, you can get more money. That's the one thing. Second things, if you want to stay at India, if you feel that it is dentistry is so much of competitive field and I can't able to survive all this thing that thing, then I say it is no. My answer is no. You can survive in India with the knowledge what you have and with the practical knowledge what we have. We have sufficient knowledge to handle or to start up a clinic. The thing is, after UG, either you pursue postgraduate and start up your clinic, or if you are not, if you can't able to afford or if you can't able to study postgraduate, you just train yourself or master yourself in few fellowship courses like implantology or facial aesthetics or cosmetology or what do you say, some sort of endodontics root canal treatment or some sort of courses you can select, and you can be a specialist in that. For example, a dental surgeon with cosmetic specialty, a dental surgeon with an implantologist, a dental surgeon with with a part of what do you say, endodontist. So you don't have to call consultant. You just do your own cases, and you can become more self-sustained. The thing is, when you go abroad and study, you have to settle over there. For me personally, after studying there, coming back to India, then again you have to come and fight with me only. If you have a plan of settling in abroad, it's worth study there and settle there. But just studying and coming back to India, it's not fair for me. Study abroad, settle there. It's a good opportunity. Is there? I don't know till when it will be there or not. I don't know.
Okay, sir.
Hope I can. If you want, I can explain in a better way also.
Okay, sir.
Thank you, sir. Thank you, everyone. Now we have come to the end of the meet. I extend my heartful gratitude to our speaker for today's session, Dr. N. Arvind Babu. Your knowledge has motivated us and made us think and realize what we are doing today. I thank our organizing heads for creating such a wonderful opportunity. And I finally would like to thank our lovely participants who were able to ask their questions and get the required knowledge from Sir. With a great sense of gratitude and satisfaction, I, Subhashri from the team of CIYF, would like to sign off. Thank you, everyone. Thank you for attending this meeting.
Thanks, man. Thank you.